In this video, we will be exploring the anatomy of the psoas minor muscle. We'll cover its location, origin, insertions, anatomical relations, function, innervation, and blood supply. We will also delve into psoas minor syndrome to provide context and enhance your understanding and retention of the information presented. The term psoas originates from the Greek word meaning muscle of the loin, which refers to the location of both the psoas major and psoas minor muscles, situated retroperitoneally in the posterior abdominal wall. The psoas minor is a slender muscle that lies anterior to its larger counterpart, the psoas major. It is important to note that not everyone possesses a psoas minor muscle. In fact, it can be absent in up to 60% of the population. The psoas minor muscle originates from the lateral aspect of the vertebral bodies of T12 and L1, as well as the intervertebral disc situated between them. It then extends inferiorly until the muscle belly tapers and forms a long tendon that inserts onto the pectineal line of the pubis, also known as pecten pubis, and the iliopectineal eminence. Some sources also consider the iliac fascia to be an insertion point for the psoas minor. Understanding the origins and insertions of a muscle can help clarify its functions. As the psoas minor is connected to the lumbar spine and the bony pelvis, its contraction reduces the distance between these two structures. Consequently, the psoas minor is considered a weak flexor of the trunk. Sources that include the iliac fascia as an insertion point for the psoas minor also propose that it plays a role in stabilizing the position of the underlying psoas major muscle. Positioned directly anterior to the psoas major muscle, the psoas minor shares many of its anatomical relations. On the right side, the inferior vena cava and the distal end of the ilium can be found anterior to the muscle, while the left psoas minor is crossed anteriorly by the colon. Innervation of the psoas minor muscle is primarily provided by the anterior ramus of spinal nerve L1, though some sources also include the anterior ramus of spinal nerve L2 as part of the muscle's innervation. The primary blood supply to the muscle comes from the lumbar arteries. However, it also receives blood from branches of the iliolumbar, obturator, external iliac, and femoral arteries. In some individuals, the psoas minor muscle may insert more inferiorly onto the femur. When this occurs, the muscle can become chronically stretched and rigid, resulting in maladaptive spinal positions. This condition, known as psoas minor syndrome, is more common in young adult females and often presents with lower abdominal pain, leading to frequent misdiagnosis of appendicitis. A surgical release of the psoas minor tendon can often completely alleviate discomfort and restore function. Your next step is to learn about the psoas major muscle. You can do that by watching this video.